Welcome back to another episode from the Optimal Body Podcast. I'm DocJen.
And I'm Dr. Tom.
And today we are talking about neck health, optimizing your neck health to hopefully help prevent any pain and injury down in the future. Now, before we dive into this, I do want to say that we have a whole body optimization kind of series going on where we already did the low back, and you can catch that video. But we're going to go over every part of the body and how to really optimize it for long-term health to, again, try to prevent that pain and injury. We can't always prevent pain and injury, but we can do our best understanding the tools and the research that we currently have available. So don't forget to hit that notification bell, subscribe so that you don't miss out on these. And if you have any questions, comments, concerns, or suggestions, recommendations that you want to hear, please let us know in the comments, because this is how we create podcasts, is we do it based on the education that you want to learn from. So definitely let us know.
So today we have episode 2 for our whole body optimization series, where we're trying to talk about all the different areas of the body, how you can best optimize that health using the movement tools that we feel would best help you for that area. We did low back in our PT Pearl from 2 weeks ago. We're going to move into upper back next PT Pearl, which is 2 weeks from now. And today we're talking about the neck.
This was like the 4th leading cause of people living with disability. Was having this neck pain, and millions of people suffer from neck pain every year. So it's like, okay, what can we do to help optimize it so that you're not disabled due to your neck or what you see on an image? And I think that's something that's so crucial. And speaking of images, we've done specific podcasts. If you want to dive in a little bit more specifically, say you have been diagnosed with disc herniations in your neck, or you feel like you have text neck and you're working at a desk all the time, or you get tension headaches, we're going to have all those episodes linked up in the show notes, because we've done specific episodes on those diagnoses. But today we're going to talk more general on what you can do to just optimize the health of your spine moving forward.
People will feel such pain up in the high cervical spine because we tend to rotate from there. And that's when we'll try to turn our head and feel kind of that sharp pain really high up.
Like if you just see where your neck kind of connects into your skull or into the back of your head, and if you kind of put some pressure and some tension, you might be like, ooh, that feels really tight, or oh, that kind of triggers a little bit of that neck or head tension that I kind of get. Well, if we're constantly looking forward and we get kind of like that pinching and that tightness really high up, you might notice, oh, maybe it is a little more difficult for me to rotate and look over my shoulder one way or the other, because we're starting to limit that rotation. And not that it's bad to get that forward head posture. It's going to happen when we're working on a computer or focusing in on something. Our head goes forward with our gaze, but it's if we're not moving out of that position. And a lot of other things that we're going to talk about. And we have to know that though the neck we're going to talk about is an area of stability, we have mobility throughout the whole neck. So you should be able to drop your ear toward one shoulder. That's side bending. Drop it toward the other shoulder. We should be able to rotate like we talked about. We should ideally try to touch our chin to our chest. So if you were to look down, and can your chin touch your chest? I'm like 2 fingers off, I think, almost. Yeah, I'm about
pretty
2
close,
fingers
but
off.
If I like open my mouth and jut my chin out
and cheat is what he's
good talk.
And then your nose should be able to point up to the ceiling, and ideally you're able to do all these motions without any pinching, pain, or restriction.
And another thing that we often have people tell us, or that they've been told, oh, I got an image and I've been told I have a straight cervical spine. I mean, if you look anatomically, and the pictures you always see, cervical spines or our neck tend to have that lordotic curve. People say, oh, I was told my cervical spine is straight. And Jen has a little study or some research that she wants to bring up that kind of debunks this whole concept of, oh, I have an image that says my cervical spine is straight, or I have an image that says I have degeneration. Because many people want to point to an image that, to their credit, they've been told by a provider, oh, you have degeneration in your cervical spine that is such and such, or it's this bad, or I'm surprised you're even walking or moving your arms. The crazy things that providers will tell us when they say, see our image, and then that's where they try to justify their services, whether that be whatever it is. But again, when we look into the research, we don't want to be the people who are trying to say, hey, your image has absolutely nothing to do with why you're feeling pain. It's not related at all. But we do want to say that there is very loose and very low correlations to what we see on images and people who are actually presenting with pain.
As we see with age from 20 to 60, we're going to see changes on the outside of the body, right? Age-related changes with wrinkles and sagging skin and changes that we see externally. Well, it's normal and age-related to then also see some changes happening internally within the disc and in the spine, and we're aging all together. So it's not necessarily bad or dangerous to see degenerative changes. And what they saw over a progression of 10 years of looking at these 20 and 60-year-olds is that they saw that there was a progression of 81% of degeneration on these images.
Like 81% of people saw progression of their degeneration.
Right.
So what degree of progression? I don't exactly know,
yeah.
But like there was progression in 81% of people, right? Sounds concerning.
However, only 34% of people reported some sort of symptoms now happening.
Yeah.
So that means there's less than 50% of people who saw,
progression on their image,
but felt something within their body.
Clinically relevant symptoms. And that's just like one thing that helps point out this loose correlation as to when people try to say, oh, look at this degeneration in your spine. This is why you're having pain. I would immediately say to them, there is no research that says what my image looks like is the reason or is 100% of the reason I have pain. There's a much bigger picture that we need to look at as to why we develop pain in certain areas. And we encourage people to discourage their providers from giving them that as the reason.
All of a sudden, now you're feeling symptoms. There's so much more that could be going on. And we've talked about this before, whether it's stress related, whether you're not getting sleep, getting good nutrients, whether you're going through a really traumatic time in your life, whether you're just not moving a lot. Maybe you're working a ton at your job and you're more static and sedentary than you've been in the past. There's so many things that relate to pain within the body. So outside of that, though, our job is movement. So we want to talk about what you can do to optimize movement of your body.
Let's get to the meat of it. The things that people are like, okay, this is all great, but what do I do?
Yeah.
And we often like to point to this joint by joint method that we'll bring up in a lot of different scenarios where certain joints we'd like to have or form a little more stability in the body, where certain joints or areas we like to have a little more mobility in the body. The neck is one of those areas we should be having more stability. Does this mean that we should just be rigid and stable and not move in this area? No. Joints around the neck, the thoracic spine, the shoulders and shoulder blades tend to be places we want to see more mobility. And that's why one of our first points in how to optimize neck health is look at the joints nearby, specifically thoracic spine and rib cage, our shoulders and our shoulder blades.
I think when people hear mobility, they first think of, I'm just going to passively stretch then, especially for the neck. I'm just going to pull my head, my ear down to my shoulder. And we're saying, no, I want you to look lower. I want you to not look at the neck. I want you to look at the upper back and how that's moving. And when it comes to mobility, it doesn't mean just passive stretching. This is why we created Mobility Foundations, which is our new course that's launching super soon, because I want you to understand finally what mobility really means and what is most important within your own individual body. It might be a little bit more passive. It might be more active. It might be eccentric or loaded. And there's a progression of how we go through within the month that shows you for these specific areas that we believe in the body based on the drum by joint method that should be entail more mobility for you. We are going to go through what that means passively, how to then actively load it, then how to eccentrically lengthen it, and then how to functionally load it within the body. So we're going to go through this whole progression. Every single day you get a new mobility video, which is kind of wild. And we're going to address primarily in the first 3 days of every single week, rib cage mobility, upper back, and shoulder health. So how funny is it that we're talking about it?
We didn't even plan it that way.
I know.
Believe us or not. Didn't even plan it. But 3 of the specific areas that Jen focuses on in this Mobility Foundations course is what we believe would help our neck health if we gain mobility in it. And it's probably because when you were forming that course, you wanted to focus on those areas that we should be more mobile.
Yes.
So that does make a little bit of sense. But this course starts November 6th, right? It's still on discount. So price is going up Friday, so make sure you get in on that. Also, if you use code OPTIMAL, our podcast listeners get a little extra discount.
Yeah.
So bonus on getting in now. But let's talk about it.
Yeah.
Our thoracic spine, our rib cage, shoulders, and shoulder blades. There's one exercise that can kind of use as an example that can really help all of these areas at once. And that's the open book. And starting
one of my go-tos.
Right? One of the go-tos. And in more of a passive method, if you're kind of like doing it where you're laying on the ground with your knee over, maybe pressing into a foam roller or a pillow or something, and then opening up. You're getting through the thoracic spine, that rotation. When you open all the way up, we'd like to encourage a deep breath into the rib cage and an exhale. So then you're expanding through the rib cage, getting that good mobility through the rib cage. And then as you exhale, trying to go a little bit further into that thoracic rotation or the upper back rotation. And then during that, what your upper body's doing is you're getting that shoulder blade moving back into retraction, forward into protraction as we're pushing forward at the beginning of the open book exercise and then reaching back. And then we're also getting some shoulder movement itself.
Yeah. And you get that rib cage to really open and expand with that, which helps with that upper back mobility. And then we can make it more active. So that was more passive, using the breath, really relaxing into it, right? And then if you want to make it more active, another exercise you could do that I love is just going near a wall. And I like doing it in half kneeling because it kind of helps to set that pelvis and low back. So if you kind of squeeze your glutes and kind of sitting into that half kneeling position, really tall in the spine. And then, so you have the front leg is the leg that's closest to the wall. And then you're going to rotate toward the wall. So now you have to rotate toward the leg that's in front without it. So it's going to kind of lock out that low back again. So your shoulder has to reach up and over so you get good shoulder and shoulder blade mobility. You breathe in to help expand and open that rib cage to allow those muscles to kind of open and work. And then that upper back has to extend and rotate. So we get this whole movement of that upper body kind of working. And when we free up the movement of our upper body, our neck can now kind of naturally start to rest on top of our body. Because if your upper back is stiff and leaning forward, well, our neck is following that pattern. Our neck is going forward and getting a little stiffer. Or if I don't know how to glide in my shoulder blades along my rib cage, well, then my upper traps and my levator scap are kind of doing more of the work every time I lift my arms. And so you might feel a lot of tension in that neck or headaches, and that neck tends to end up working a little bit harder. So if we can free up what's happening below the neck, we naturally start to stack our posture without forcing anything, and we free up tension at the neck.
Neck. Yeah. So stability, we talk about neck as being something that's stable. This doesn't mean rigid. This doesn't mean it doesn't move. Jen earlier talked about the 6 different ways that the neck can move into the side bends, flexion, extension, and rotation to both ways. So how do we develop stability to be able to control through all that range of motion so that our neck feels safe to go through all that range of motion and we're not just cranking all the way to the end ranges, feeling unsupported in a way that might cause our muscles to want to guard or want to spasm.
Yeah. And so one of the first ways, I think most people have heard of a chin tuck, and that's kind of pulling that chin back so that we start to work on the deep neck flexors in the front of our neck, right? And that helps to kind of support, if you think of more of that soldier type of posture, you know, we're getting that neck kind of back. But we don't want to just jet the neck straight back. What I like to think about is that neck is, or that head is kind of rotating along an axis. So the chin is going to go down and back as the back of the head comes up and forward. And we end up kind of rotating up and back. And almost like there's a string at the back of the top of the head, and it's kind of lifting you up, right? So we get this backward motion with a little bit of a lift. And that helps to kind of more so align and get into a more natural posture. One thing I do want to note too, and this is something I've told our members, is that when you're doing a chin tuck, the goal isn't to get as back as far as possible. It's where is my body functionally? So if I go into that chin tuck position, can I swallow?
I was going to say that's a good barometer for if you're just jamming your chin way too far back into a place that's abnormal or unnatural for your own body. Because people will always do the exercises against the wall, and you'll hear people say, okay, you want your pelvis, your low back, and the top of your head against the wall. And some people are like, my head's a whole fist width away from the wall. And that's fine. That might be exactly where you need to be right now. But I like the chin tuck and try to swallow method. After we just work on this chin tuck, then we want to talk about, okay, how can we load it? How can we build endurance in those muscles? A great way to do that is lay on your back, kind of laying supine on your back, and then get into that chin tuck and just barely lift the back of your head off the ground, enough to maybe slide your hand underneath, but barely. And you'll feel it kick in really quick. There's actually tests we do. It's the deep cervical neck flexor endurance test, where you see how long you can hold before you feel that chin jut out or need to put your head back down. Another way to then use this chin tuck while introducing the movement is get in all fours in kind of a quadruped on your hands and knees type position. And then you can do the chin tuck and work with your ear towards your shoulders, side to side. Get the chin tuck and do some light rotation. Chin tuck and try to lift your head back so you're going into that extension. And it helps you start to explore in this slightly more stable posture using those deep cervical neck flexors through all 6 of those movements.
Our last point about neck health. This is where, in order to start to prevent a lot of that tension buildup at the neck, in order to help reduce any guarding or accessory muscle use at the top of the neck by lifting the shoulders up to the ears, we have to be able to efficiently use our breath. And this is so incredibly important, especially when we go back to our other point about getting better mobility through our body. Well, using our low rib cage to start to expand in our breath in a 360-degree pattern. So not just belly breathing and letting your belly relax. That's in addition, but putting your hands on the sides of your low rib cage and saying, can I breathe into the sides of my low rib cage without my neck turning on, without my shoulders rising up to my ears? So sometimes doing this in front of a mirror is really, it can highlight a lot of like, oh wow, my neck muscles just want to fire as soon as I inhale. Like that can tell a lot of the story of what's happening, of the constant tension that's happening around the neck. So just starting to work on this breath can really help to reduce a lot of the tension at that neck. Use your neck stretches. If you like your neck stretches, we're not saying to not do them. I do them. I like them. This is where you keep your shoulders stable. Maybe you grab onto a chair and you use your other hand to slowly assist your ear to your shoulder or your nose down to your armpit. Those are great stretches. They help to relieve a lot of tension.
And they can feel good.
In the neck, and they feel good.
Those are the main 3 tips for neck health. Make sure you look at the areas above and below, hit that thoracic spine, the rib cage, shoulders and shoulder blades. Find stability in that neck so you feel safe moving through the range of motion that you do have, and use your breath to best set up that neck for success in all those different ways that we just talked about. Thanks for joining us for that episode of our body optimization series, all on optimizing neck health. Did you learn anything? If so, comment below. Are there things that you have found help your neck health or neck pains? Please comment them. Also, if you have any questions, just let us know. We're always looking for what you want to know so that we can continue to make more content and more episodes to best serve you.